Welcome to the Equine Vet Connect podcast. I'm your host, Dan Carter. I'm a veterinarian and a farrier. The goal of this podcast is to educate horse people, break things down, bust myths, and keep it real. Speaking of breaking things down, here's my legal disclaimer to keep my attorney and insurance company happy. While I am a vet, I may not be your vet. Contact them before trying anything you hear on this podcast. Remember, just because you watched it on YouTube or heard it on a podcast does not mean you can do it. Please use common sense. Welcome back to the Equine Vet Connect podcast here at Countryside Equine Hospital. We've got another exciting episode for everybody today. Got with me Dr. Zoe Latimer.
Good morning.
We're here in the old studio, old treatment room 1. Before we get started, I just want to do a big thank you to our listeners. We got some statistics in the other day. Zoe, we've been streamed in 25 countries.
I want to know the countries, though.
I mean, it is really cool.
What's
25
the
countries.
one?
Yes. So,
do they list them out for you or no?
I'll tell you what. If you're listening in another country, please tell us what country you're listening in. We'd love to know where all we're going. But
yeah, make a comment on the video. Tell us where you're listening from, or the city, state.
Yes.
We want to know. I'm
we want
interested
to know
now.
because I thought that was crazy. 25 countries.
That is so cool.
This little podcast we just kicked off this year here in Covington, Georgia, and we got 25 countries listening. That's pretty cool. And we're also in the top 15% of video podcasts on Spotify.
That's super cool.
So this is really cool. So thank you to all our listeners. Y'all keep sending your ideas for content. We actually have a lot of fun with this. I really enjoy it. Mm-hmm. I look forward to it and really enjoy it. So, well, let's get into our topic today. The pre-purchase examination.
Oh, good old pre-purchase exams.
I have a love-hate relationship with these.
I actually don't mind them. I enjoy doing them.
Oh, I love doing them.
Yeah.
But then sometimes I hate what comes with it.
There's a lot of red tape. There's a lot of you got a CYA. That's a good
yes.
Cover your A,
Well, and you think about it, there's a lot of trust that gets put in the veterinarian doing these PPEs, right?
Oh, yeah.
We're uncovering. We're kind of the eyes of the buyer, and
pretty much we're working on that day. We're working for the buyer.
Correct.
Yeah.
Working for the buyer, and it's our job to uncover anything and everything that could be of importance. Mm-hmm. And I think that's there's a lot of responsibility with that.
Yeah. Well, and also I have had many people try to kind of get me to do something that's dishonest, and mm-hmm. It's really important that the vet stays true to, nope, I am doing this. I'm sorry, I cannot do that.
Well, and I think it's always about, and I think that's a big thing is understanding what is the purpose of the podcast. We get down to what is a PPE, what are the goals of a PPE, because I think that's where a lot of confusion can happen. And, the PPE is a discovery mission. Mm-hmm. It's to try to learn as much as we can about this horse, but unfortunately, it's a single point in time.
Yeah, well, let's back up even further. So a PPE is a pre-purchase exam. Mm-hmm. Most pre-purchase exams are done before you purchase a horse, ideally.
Ideally. We do a few post-purchases.
We do.
Not ideal.
And a pre-purchase exam usually consists of a very thorough physical exam, a neuro exam, eye exam, oral exam, that's the mouth, lameness exam, as well as imaging, such as radiographs, less commonly ultrasound, and any other imaging. Some very rarely people will have us do upper airway scopes. Mm-hmm. Have you done any other imaging?
I've actually done a few bone scans on PPE.
Really?
I have had a few that we've done bone scans on.
I have not done one of those yet.
Yes, I had a few that we've done that on. Not recently, but used to be a little more common. We used to do some bone scans, like if we had some concerns.
Oh, and blood work.
Blood work, yes.
Blood work.
So those are, because the whole goal is to find out who is this horse? Mm-hmm. What's going on. We try to, I always tell people it's difficult because they're trying to get a crystal ball. We're trying to crystal ball some of this. What's the future going to hold?
Right, and what we try to tell people is a pre-purchase exam is a wonderful thing because we uncover a lot of stuff, but also you have to take in mind we are seeing the horse on one day out of its entire life. Mm-hmm. And we're going to comb through it from head to tail, and I'm going to tell you the good, the bad, the ugly.
Yep.
And I'm going to present it to you, and then you make your decision whether you still want to purchase the horse or not. We don't pass or fail. We just give you information. That's what we do.
That is very important right there. It is not a pass fail. I will never say those words. It's just simply we're going to uncover information, get you that information,
Yeah.
and allow you and your advisors to make a decision. And you know, the other part is too, when we're doing these pre-purchases, is remembering like this is just the medical side. This has nothing to do with temperament. It has nothing to do with, you know, the horse's talent. We're one piece of it. I like to say there's a whole bunch of pieces of this pie, and we're our own little piece.
Well, and I will say a little bit about the temperament thing. A pre-purchase exam tends to be kind of a long examination, and I'm doing a lot of poking and prodding, and we're flexing all of the legs, and I'm underneath that horse working for usually about an hour and a half. Sometimes if we're taking a lot of x-rays, it's like a 2-hour long process. And so I kind of get to know that horse through the process. And if you're a mom or a dad, and you're coming to me and telling me that you want to buy this as a Christmas present for your 6-year-old daughter or son, and this horse is trying to eat me and my tech for lunch, and it's trying to kick me and slam me against the wall, and it's being terrible for us, and they're telling you that this is a great children's horse, I'm going to probably pull you to the side and say, I don't know that this horse is going to take care of you and your 6-year-old. I'm very experienced. My tech is very experienced. This is a little bit of a personality test.
I would say that's the exam within the exam, right?
It's kind of like a sneaky exam, because I'm like, this horse has a kind of not the personality you're looking for. This horse is made for somebody that can fend for themselves a little bit.
Well, you know, what's interesting is I've got a couple horses that are terrible to work on the ground.
Yeah.
Like for vet care, farrier care, they're awful. They're amazing in the ring. They're amazing in the show ring. And they're actually amazing every other aspect of their life, easy to work with. But for whatever reason, they don't like vets and they don't like farriers. And so you have to take that into consideration. You know, some of these horses, they just, for whatever reason, they don't like to be shod and they don't like vet care. But at the same time, they'll take care of, you know, I've got one that, or he's a terrier to work on, but at the same time, he is fantastic for this kid. I mean, absolutely fantastic. So all those things sort of play.
I know a couple that are that way too.
Yeah.
Yeah, they're the bomb. They make awesome kids' horses, but they just hate the vet. They hate needles.
And, you know, good news, that's only one piece of the horse's care.
But it's true.
So we'll find a way to.
It also all rolls back into, we just see them on one day.
Right.
And for about 2 hours, you know, give or take, 1 to 2 hours. It just depends on how the PPE is going and what all you want done.
And speaking of that, you know, what I always tell people is when you go into a PPE, you want to have a plan. And I think it's important for owners and trainers to have that plan. Part of that plan is the more information you can get us before we do that PPE, the better. Like if you know there's past history, if you know that there's past radiographs somewhere, if you know the past show records, what this horse has done, any past injuries, anything you can get us from the past, that's fantastic information. Love to have that stuff. Sometimes we have it, sometimes we don't. It all depends on the situation. But I think having the more information we have about the past, the better we can try to help you see what the future is going to hold.
Yeah.
So, and then having those list of questions, things that you may have identified that, like when you've tried the horse, you know, maybe they have trouble with the right lead. Maybe their pee off if you're doing dressage isn't quite what you want it to be. If it's a barrel horse and it really struggles turning a certain barrel, if it's a reiner but has trouble in stops and spins, different things, pay attention when you're trying this horse to say, hey, I didn't expect this, or these are the things I'm seeing, because that gives us information to help us get a more complete exam as we're doing this. Is there an issue somewhere, or is it just the horse?
Yeah. One big thing too, I would say on PPEs is managing your expectations, I think, about what the horse is capable of doing. I think people often will either undershoot or less commonly overshoot or other way around, more commonly overshoot what they think a horse is capable of doing.
Well, and I think that comes into when we're looking at these horses. One of the first questions I ask is, what is your plan for the horse?
Right.
Like, what do you want to do? Are you looking for a 2-3 jumper, or 2-3 hunter? Are you looking for a cross rails horse? If it's a dressage horse, are you looking for something to go all the way to the I-1s, maybe the Grand Prix? Or are you looking for something to go to fourth level? What are your expectations for the horse? Because it's our job to look at them from a medical perspective and say, okay, physically, can they do the work? Now, talent, I'm out. Talent, that's you and your trainer's job.
Right.
Our job is medically, can they do the job that's intended for them to do? And I think so knowing what your plan is with the horse, because that also affects how we interpret certain things. We're going to look at, if you're looking for a Grand Prix dressage horse, there's certain things that we're going to look for and certain things that we can tolerate and certain things we can't.
Oh yeah, like with the number one, if I walk up to a horse and you're telling me you want to buy it for a Grand Prix dressage horse, if the confirmation is all off, immediately I'm going to say, I don't know.
Yeah.
I don't know about that.
Well, and those are important.
If it's built like a limousine.
Really, really high in the butt. I see
Yeah.
that a lot. You'll get these horses that are really hip high. They're
really
kind of built
long in the back,
downhill.
and I'm like,
You're like, medically we may be able to make it, but I don't know that we're going to be able to get
it's probably going to be like your fourth level max horse.
And confirmation is one of those things. We may make some comments on it, but that's really up to you and your trainer to decide. Confirmationally, do you think this is a good fit?
Yeah, I have seen some very some horses like that I never thought would be able to do it. They're out there doing it, but in general, yeah.
Yeah, so we're digging in, knowing, like I said, knowing the questions you want to answer, knowing what what your intentions are with the horse is kind of the first part of the pre-purchase. And, really they're custom tailored. It's not a one size fits all. Depending on what you want to do and what your expectations are is going to help us a lot. Like one of the questions I ask a lot is this horse intended for resale?
Yeah, I guess I just don't do a lot of PPEs where they're intending to like resell them. I do a lot where they just simply want to purchase the horse. I think you probably do a lot of resale horses.
Yeah, a lot of mine, they'll come in and they're at an age like, hey, we're using this horse to go, we're currently jumping like meter 10, so we want a meter 20, meter 30 horse. And then we plan on that horse plans on getting resold once certain goals are accomplished.
Yeah, see, I guess I just don't do a lot of PPEs that are like that. I do a lot of like kind of, no, we just want to buy it.
Well, and that's to me, that's a very important distinction.
Yeah.
Because
for sure. Yeah.
When you start getting into the resale, now all of a sudden it's not just what my opinion is, but I could say, okay, you're planning on reselling this horse in 2 to 3 years.
You got to think about the next person coming down the line, because you got to think about what they're going to want to see.
Right.
Because future buyers love to see x-rays. They love to see show records. They love to see that you've kept, if maintenance is necessary, that you've kept up with joint maintenance. They like to see that you've kept up with vaccines and Coggins, of course. I mean, those things seem so simple, but it's absolutely important, because if you can't keep up with something simple like vaccines and Coggins, they're going to question, can you keep up with the other stuff? And people like to see that, all the imaging was done at this pre-purchase. And also if they're going to do imaging at the next pre-purchase, being able to have the two to compare the changes. So say if the sets of x-rays were taken 2 to 3 years apart, it's nice to have them to compare, because you can measure the change. Or if there's minimal change, that's great. If there's like hardly any change, if there's barely any change between those sets of x-rays and that horse has been in a lot of work, that's a great thing. That means that the horse is being well taken care of. Versus, if the horse is breaking down pretty quickly between those sets of x-rays, then you can imagine that in another 3 years, maybe it's not going to look so good.
Well, and I think it's, when you're thinking about that, when that next vet does the PPE, what are they going to think?
Yeah.
I remember John Steele, he was kind of a legend. John Steele, he started out in the standardbred world, ended up in the sport horse world in South Florida. And I'll never forget having dinner with John. And John says, Dan, I always decide what I can manage and what I can't. And I remember thinking, I was like, well, John, what you can manage is way different than what I can manage. Because I swear John can manage a 3-legged horse and get him through, a 1.40 course. I mean, John he was a phenomenal vet. And, he said that, and I always think about that when I'm doing these PPEs for resale. It's like, okay, what I'm okay with and what I know that I can manage may not be what somebody else can, and also what owners are willing to manage.
Totally vet dependent as
Right.
well. The skill level, the experience level of the vet, the comfort level of that vet, their access to resources also completely is going to determine all of that. Like what they feel comfortable managing.
And some of these PPEs I do will be being shipped overseas. And like I've had
They have different products than we do.
different products,
Oh,
but
that
then
adds like a whole twist.
vet availability.
Yeah.
I work down in, as I've probably heard before, I work down in Grand Cayman, and when we send a horse down to Grand Cayman, that PPE looks completely different than a PPE up here, because they've got to depend on someone to be able to get down there. So a lot of times they're waiting on me to get down there. Something here that we can intensely manage, they're not able to intensely manage. So our tolerances to go down to the island are a lot slimmer than they are up
Right,
here.
because you can't have reliable vet care like on demand.
Right.
Like the vet comes twice a year. So this horse has to be able to fit within those parameters. And that's also true even if you live around here where we have a lot of vet access. If your budget, you can only afford a vet twice a year, then you don't need a horse that is super needy.
Right.
You need to be realistic with yourself. If this horse is going to need a lot more maintenance than that, then you need to be realistic with yourself and say, maybe this isn't the horse for me. Maybe I need a less needy horse.
And that plays in, because, like I said, I've had even horses in the U.S. that, like, we had one we sent to North Dakota, and it was like, I'm doing this PPE and it's going to North Dakota. And I remember the owner telling me, like,
for every 6-hour radius.
yeah, she's like, I remember talking to the buyer of this horse, and I was like, these things are going to need to be done. And like, that's great, but I'm 6 hours away from a facility that can do this, or I'm 3 hours away.
There.
Right.
Oh yeah. The vet doesn't come to you.
it's more than I can deal with.
Yeah.
Something that seems very simple around here.
Like something that we think is so simple, like, oh, it needs its toxin injected once a year. We think that's so simple, but up there, it's like, that's a game changer.
Yeah, it may be that, like, it's going to be too much for me. So, kind of going back to think about all these things before the time of the PPE, so we can set those goals. One of the other things I always ask is, do you have any concerns that you want looked at?
I ask that question too. I say, when you went and saw the horse, or when you were talking to the seller, did anything come up that you thought was either strange, that made you think twice, kind of made you go, I wonder why they said that? Or when you were riding it, did you feel anything weird? Or did you notice anything weird as they were tacking it up? Like anything at all? And like, I ask people that question.
It's one of my favorites, because that also leads to, have you had past issues with other horses? I've had some people that have had bad luck. Let's say they've had horses with a suspensory injury, and they're terrified about another suspensory injury. It was just not a great experience. And so they become hyper vigilant on something like that. And so there's things that we can do to help try to settle any concerns. Or if they've had a horse that, hey, I've had this issue in 2 horses, I do not want this issue again.
Yeah, I remember specifically having to collect urine from a horse one time on a PPE, which, I mean, I guess they do it all the time in small animal, but we don't do it that often in horse, like on PPEs in horses. But had to collect urine on a horse because a lady, she had like 2 in a row horses that had like stones.
Oh, wow.
And like I ultrasounded the bladder and collected urine.
Yeah, because again, it's a concern, and they don't want to deal with that. So that we try to.
I was like, this is weird on a PP, but okay, I'm not going to question it. I was like, if you've been burned twice, I'm not about to be the vet that does the 3rd time.
Right.
I'm not about to be that guy.
Because that's our whole goal, is to settle those. And the one term I like to use a lot to describe a PPE is risk mitigation.
Yes.
We're trying to mitigate risk.
Right. Yeah.
again, it's a single point in time examination. We can't rule anything out. I always say I got 2 guarantees. They're going to go lame. They're going to colic. I just don't know when. But we're trying to minimize the risk. And we're trying to uncover as much as we can to minimize your risk. And it also comes down to risk tolerance. When you're doing this PPE, where are people's risk tolerance? That's one of the things I ask a lot of people. Where's your risk tolerance? Because some people are willing to take more risks than others. And so that can, as we're going through explaining our findings, a concern for you may not be a concern for me. I may be willing to take a risk that you may not be willing to take. And so knowing some of those tolerances
In general, I am much more, on my PPEs, I am much more cautious.
right.
Like, I'm like, no.
Well, I mean, as a buyer, different
Yes.
buyers have different risks.
Oh, I see what you're saying.
Yeah.
Yeah. Oh, yeah.
Yeah, different buyers. Like if I was buying one, I may be willing to see more risk than you.
Yeah,
And
that's
so
true. That's true.
those are all important things to kind of once we understand the buyer and the situation, it
Also, a
allows
little
us to
bit
really
depends
take
on
it.
what you find as a buyer, because if you find, depends on what the finding is, and as a buyer, if you're planning on reselling it, because if you're, say, for example, here's what I'm thinking about, like, I found that surprise screw in that leg.
Yeah.
If you're, even as the horse was sound on the leg, and it's probably not really going to cause an issue down the road. Like, it's been in there for years. Nobody knew about it. It's probably going to be fine. I'm willing to take the risk and buy the horse. But I would probably have a very, very hard time reselling that horse and convincing someone else down the road to also take that risk and buy that horse. But if I'm never planning on selling that horse, it'd probably be fine. But I probably wouldn't take that risk if I had the intentions of reselling it. Does that make sense?
Yeah, it narrows your scope of,
Yeah.
of people. It kind of narrows your scope.
Yeah.
And I mean, I've got a 1.40 meter horse right now that's got a screw in its knee, had a cyst in one of its carpal bones. They put a screw in its knee. Had a fantastic show record at the 1.40 meters. When we did the PPE, yes, we went in and looked at the joint. Yes, the screw was there. The buyer's like, hey, I'm willing to take the risk. Resale's not in the forecast. The horse has been competing, doing well. We made sure we really looked closely at the knee to make sure that, because we knew the screw was in there. The sellers told us. We knew the screw was in there. We took a really hard look at the knee. We made sure everything was good. And like I said, that's probably 3 or 4 years ago, and we're still clocking out the 1.40 meters, no issues. And that's another thing that helps out a lot is, when you have something like that, you've got a past show record. This horse has been competing for 3 years with the screw.
Yeah.
It's got no breaks in the show record. The horse has been maintaining great. The sellers told us, like, hey, this is what we've done. This is what we've had to do in the past. We've got a really good idea of what we're looking at. We pay really close attention to that area. And like I said, this horse, knowing it's there, knowing we got to manage it, we like I said, it's been 3 or 4 years, and we're still doing the 1.40 meters, no issues. So I know the one that you found, complete
a surprise
surprise.
to everybody.
Survey Films is where you found that.
It was a surprise to everybody. PPE was over.
Yep. And so then we kind of dive into this PPE exam, the things that we're going to do. We all have different places we start. I like to do that thorough physical exam first, heart, lungs.
Well, actually, really, I start with my questionnaire.
Well, that's what we start with always interviewing the owners, interviewing the sellers, getting as much information as we can. But,
Yeah.
Once we pass that, we get into that baseline physical.
Yep.
And I always like to say if their heart's not working and they can't breathe, the rest is details.
Yeah.
So let's make sure we don't have a murmur,
Yeah.
don't have an arrhythmia.
Yes.
Interesting enough, I've been doing PPEs for 15 years. There's no telling how many hundreds I've done. I keep waiting for the day that I put the stethoscope on. I have a murmur. Hasn't happened yet, but I think
I've had
you
2 or
have.
3.
Yes.
Yes. That's the first thing I do on a PPE on my exam is I walk up, well, after I've done all the questionnaire and talking to the owner and the buyer and the seller and everybody and da-da-da-da, I go up to the horse, like, and, put my stethoscope right on the heart. I found a tetralogy of Fallot,
That was a 3-year-old horse too.
3-year-old thoroughbred. Yep.
Completely unexpected because
They used him as like a teaching horse at the university. It's kind of
Yes.
cool. because you don't, like, those are extremely rare.
Especially in a 3-year-old.
Uh-huh.
Most of them don't make 3 months.
His heart sounded like a washing machine. It was cool.
That's wild.
Yeah. And I found a couple of other just like straight up murmurs and one arrhythmia.
It's interesting because I have not had that situation come up yet. I'll have some second degree AV
Cataracts,
blocks.
horrible cataracts I have found before.
Oh, interesting story. That's
The horse is blind on one side.
one of the first things I check now is vision.
Yeah.
Because again, about 10 years ago, I had a horse. We had they'd had the horse on trial for 30 days. It was back when the trials used to. A lot of times you could get a trial on a horse.
I feel like those used to be more common.
They were. We don't see them much anymore.
I could think it's everybody's getting much more like I'm afraid I'm gonna get sued or something's gonna happen. Yeah, but back in the day, trials were way more common.
Very
I feel like
common.
nobody bought a horse without a trial, which I feel like was a little bit smarter in one way and then not. I see it both ways. I'm like, I also, if I was gonna buy a horse, which I'm not, but if I was gonna buy a horse, I would love to like do like a little trial era, but like I feel like it's going away.
I think so. It's not near as common.
I know.
But we'd had this horse for 30 days, or the trainer had the horse for 30 days. It'd been jumping great. I think he was a 3-foot hunter. I'd done an entire examination on the horse. Used to, I'd always do the ophthalmic exam at the end. That way, because most of the time we'd have to sedate for radiographs, so while they were sedated, it was a great time to do a thorough ophthalmic exam. And we get down, I go to do the menace, and this horse is completely blind in the left eye. And no one knew it. I mean, this horse had no indications of being blind. He was fine with you touching him on the left side. It was a left eye. Fine with you touching him on the left side. I mean, never showed an issue saddling up, never missed a distance.
Wow.
Everything, like, there was no
He'd
indications.
probably been blind for a long time then because he had just learned to live with it.
Well, we found out, like, this is where if we can get that history before,
Yeah.
it really helps. But once we discovered that, the trainer dug in and found out he'd had recurrent uveitis. And it's somewhere along the line, even the according to the sellers, they were unsure that they didn't know the horse was blind, which I could actually see in this case because there was no indication this horse couldn't see.
It's just a good boy.
So now after heart and lungs, I check a menace.
Yeah.
I check a menace and do my cranial
I check a
cranial nerve
menace on
exam.
every physical exam I do, actually. Like when I'm doing shots, I check a menace every single time I do a physical exam on a horse.
Yep.
Like, so that most horses I see, I do it twice a year.
Right. When this one,
'Cause
like
I'm
I
over
said,
there, like I might check their gums and I do like this, check their eyes.
when
I
that,
have found quite a few horses just like on regular exams where owners didn't know that they're like half blind.
right. Well, that was the interesting thing
It's
here
not like
is,
it really like changes much, but it's just like it's good for the owners to know.
yeah, we had no indication, and they passed on the horse, but the horse still had another. I know 3 years later it was still showing and doing fine, but
I
it
don't
was
really
risk.
get scared of a half blind horse. I really don't. I'm not really that bothered by it.
No, but when I'm looking at jumpers and we're doing a PPE, it's like let's don't buy a problem. And like we know we've had uveitis, we have no
That's-
idea
yeah.
how long before the other eye becomes affected.
Well, uveitis is a different story, but if a half blind horse, if it's not from uveitis, because uveitis can quickly become bilateral, but if it's from a different reason, a half blind horse doesn't really bother me because they learn to live with it. And then you have two.
Yep. And that's where it comes down to, where's people's risk tolerance on that PPE.
Yeah. I know actually, like we have a client who she has a double blind horse that she trail rides. And that horse is pretty cool. It's a mare.
That's cool.
Yeah.
So we get into, the palpation part of the exam where we're feeling around. One of the big areas I always check is I'm looking for scars. I know where surgeries have been done. I look for airway surgeries. I look for if they've had an neurectomy. Another big one is crawling under that belly and looking, do I have railroad tracks where we've had a colic
A
surgery?
big colic scar, yeah.
Because I have found a couple of those that had no history of colic, and then I roll under there and it's like,
Yeah.
somebody's been in this belly.
You can feel hernia repairs too, which are not as big of a deal, but they can get like tiny little adhesions there and not as big of a deal, but yeah, big colic scar and nobody tells you about it beforehand. That's a big red flag to me.
Well, I think sometimes it gets lost in the shuffle. That could have happened as a 2-year-old. It's been through 3 or 4 owners, and now here we are. And then it
That's
becomes
true.
like, well,
If,
hey,
if the horse has changed hands a lot, yeah, things do get lost. But if it's had one other owner
yeah,
and they didn't tell you about it,
Yes.
That's not a good look.
Questions.
Not a good look.
Questions. So,
Yeah.
yeah, then we get into the soundness portion of the evaluation. And I think this is what most people, when they think PPE, this is what they think. They think we're checking for lameness. They forget about all these other little things like the heart, the lungs, the eyes, the mouth. Most people are really interested in, is this horse sound? And
I mean, that's a pretty big part of it, especially for a performance horse.
right,
I mean, I've done PPEs before on horses that weren't going to be performance horses, and the lameness exam wasn't the most important part because they were just going to literally walk it on trails. But for most people, they want to buy it as a show horse, and at least they want to trot and canter around quite a bit. So
right.
the lameness exam is pretty important to them.
Yes.
So
Well, I think, my rule, what I like to see on a soundness evaluation is I like to see horses that are baseline sound, hard and soft ground, trotting in straight lines, and lunged. I want to see baseline soundness. If I'm baseline sound, but I've got some positive flexions, that doesn't worry me as much. The other thing in that is one of the things I hate hearing on a PPE is people are selling the horse. Because they're selling the horse, they didn't want to do maintenance. They didn't want to get hocks done. They didn't want to get a coffin joint injected. They know the horse needs these things. And so you get there and the horse is lame on the left front, flex is positive. You're thinking like probably needs his coffin joint done. The seller says, yeah, he just needs his coffin joints done. Once he does that, he'll be sound. And I'm like, well, we don't know that. I would much rather say, hey, we injected this horse 30, 45 days ago and have a sound horse on PPE. He has regular maintenance of hocks and coffin joints. And that was done 30, 45 days ago. The horse is sound.
yeah.
I'd much rather hear that than have a horse with some really bad flexions or baseline lame. Like, oh, well, he was due for his maintenance, but because we were selling him, we didn't do it. Like, no.
Right.
If you're selling the horse, make sure it's maintained.
Because how do I know that those positive hock flexions, oh, he just needs hock injections, or I have high suspensories?
Right.
How am I supposed to know?
Don't know. And then they're
Until
like,
I get into the weeds.
yeah,
How am I supposed to know?
and like attorneys say, like that's hearsay.
Yeah.
That's hearsay. You're saying that that's going to make him better, but I don't know that for sure.
Also, I don't know you.
Yeah, and it's like right now, what I've got is I got a lame horse.
Yeah. Yeah.
And
If I go to a PPE, and like you said, if the horse, with the just baseline, the horse jogs out and it's lame, we haven't even done flexions yet. I'm like, great.
Yeah.
This is going to be a fun one.
Well, and I think that one of the things I tell people, there's a distinct difference between a PPE and a lameness exam. We get there and the horse is lame. And they're like, well, why is it lame? I'm like, no, that's a lameness exam. That's outside the scope of
people
a
very
PPE.
often that's what I'm saying. Like, that's kind of where I was about to go. It was like, when I'm at the PPE and the horse immediately, I haven't even flexed it yet, and it jogs out lame and comes back. I have had literally at the PPE, people want me to start doing a hind limb blocking lameness. And I am already on like 1.5 hours of this PPE. And then they want me to start doing this blocking leg lameness. And I'm like,
Well, the other part of that is
like that's not what I'm really here for. I'm like, you should like
well,
not do that right now.
the thing I look at is like, if we're talking about nerve blocks, we're talking about a lameness evaluation. And I have
Yes.
done,
And people try to get me to do those on PPEs, and that's kind of what I was getting at. It's like, I'm like, I find it really, really hard to like, I feel like I'm crossing
Yes.
so many boundaries
Yes.
doing all of that because I'm like, I'm looking at the seller and I'm like, do you really want me to do that right now? I'm like, what if I find something like that you don't necessarily want people knowing as a seller? Like, I don't know. I feel like it's just really lots of gray area that.
what I look at is if we go out there, like, I've done thousands of lameness exams and I've blocked thousands of horses. 90% of the time, the blocks don't lie. We get to the bottom of what we're looking for, but sometimes we don't. We got like anybody that's heard us talk about lameness exams on here, we know that like, yes, this block should get this area, but blocks migrate, blocks drift. And there's a lot more that goes into a lameness exam. And to me, that's at that point in time, the pre-purchase is over. We're getting into a lameness evaluation. That's not on the buyer. We need to go figure that. That's a separate visit. That's a separate appointment. I usually try to recuse myself at that point in time from doing the lameness exam. I would rather somebody else do it to take the risk
Well, that's
away.
what I'm saying. It's like, I feel like I'm crossing so many boundaries. Like,
Absolutely.
how do you, like, I get asked that.
Yeah,
Not uncommonly.
when we get into the diagnostic side, that's
Yeah.
someone else.
Yeah.
That's not what we're here for. And I think
Yeah.
that's an important line for people doing the PPE is
But the buyers will even be like, yeah, we can block. I still want to buy this horse. Like, yeah, block it. I want to know. And I'm like,
I won't do it.
yeah.
That's a
Yeah.
hard line that I don't cross. If someone wants me to come back and do a lameness evaluation, I will come back and do it, but I will make the distinction of not even doing it that day. Like at that point in time, if we're getting into a lameness evaluation, that's a separate appointment. I want two distinct visits. I don't want to get involved in.
See, yes, yeah, that's what I'm saying. It's just like you're getting so like into the weeds.
Well, and a lot of times people say, "Well, he had an issue with the last shoe, and can we just block the foot out and see if that's what it is?" Maybe it is foot
That's what they
soreness.
always try to convince you.
Yeah,
They're
maybe
like,
it is a
"Oh,
foot
It
soreness.
just has flat feet.
Yeah, and maybe that
And you
is
go
it.
all the way up to the high for it.
Or maybe this horse has a deep flexor tear down by the, like that's what I mean. Like that's outside the scope. Like a horse needs to be sound on baseline PPE
Yeah,
because if it's lame, we're no longer doing a PPE. We're doing a lameness evaluation.
yeah.
Two distinct things. So bottom line, you want a horse that is sound on baseline. If we've got some positive flexions, that's a little easier to work through.
Right, right.
A little easier to work through.
I totally agree. Totally agree.
And that's something too that plays into when we're talking to the potential buyers is, I like to ask like, where are your hard lines? And so this is something for buyers to think about. Where's your hard line? If this horse is lame, are you still interested? If where are your hard lines? Like, this is not what I want to see. And I think that's something to discuss with your trainers, your agents, kind of determine where those hard lines are. And, sometimes if we're buying, and it depends. If you're buying an 8-year-old horse that you plan on, getting a capital challenge, or if you're buying, hey, we're buying a 17-year-old horse for somebody to get started, we know there's going to be issues. We just want to make sure we can manage it.
Yeah.
So knowing where those
Which
hard
is
lines
very
are.
realistic. And
Right.
I appreciate when people come at me and say that. Like,
Yeah.
I'm like, I'm really like, I really appreciate that.
So, we get into that. We've done the soundness evaluation, and this is where it gets interesting.
Also, one comment that I will make is if you know that you're about to if you are a seller and you're about to have a PPE done, I can't tell you how many times I have done a PPE on a horse that is 10 weeks into their shoeing cycle.
Yes.
They are missing one or more shoes. They just threw it yesterday. They just threw it this morning, etc. So what is your idea? Or they were just shod 2 days ago. And so or they cut them short. So what is your ideal time in the shoeing cycle to have a horse seen for a PPE? Because I can tell you it ain't right when they get their feet done or right when they're about to be done or way overdue for their shoes.
Well, to me that depends because, I was a farrier for 10 years before I was a vet.
That's why I know this is a great question for you.
And, at first I hated shoeing a horse before a PPE and I didn't like shoeing one before they went to the show because it's like if you make a mistake, now the PPE suffers. So what I look at is like if you're a seller, like give your farrier a chance because they are going to make mistakes. But at the same time, shoeing a horse should not affect its soundness. Shoeing a horse, the horse should not be worse. My thing is like if you shoe a horse and it gets worse,
Yes.
like if every time the farrier comes and this gets worse, that's an issue. That's an issue. That's outside of a PPE. Like you should be able to shoe a horse and it not change the soundness.
Correct.
There's a lot. That's a whole nother
That's a whole,
discussion.
what you mean is that's a whole other can of worms.
Yeah, it's a whole nother can of worms. So to me, like it should not have a bearing. Now, do I want to see a horse that's 10 weeks into a shoeing cycle? Absolutely not.
I can't tell you how many times I have done that.
See, we're in a whole
Those shoes are
different.
hanging on for dear life. The feet are going over the shoes. The feet are holding onto the shoes.
Yeah, you need to make sure you present a good product there. So,
Amen.
yeah. Yeah, and one of the things that we used to do a lot of, I still do some of, but it was a big deal probably 8 or 9 years ago, is we used to do a pre-purchase. If I had buyers that were
Yes,
selling a
we
horse,
don't do many of those, and I really wish that we did.
yep, we used to do a lot more of them, and it was before someone was selling a horse, they would have you come out
The
and
seller would
Right.
actually have you come out and do a pre-purchase exam
Yeah.
on their horse that they were willing to or wanting to sell.
and it did become even more common during COVID because we were doing, if they were going to market the horse, they would market it with a pre-purchase exam and a set of X-rays. That was a very common thing because people were having to fly
That's a
in.
European thing now. Europeans already they already have a full set of X-rays when you come to look at their horse. Yeah.
And I think there's some good, what I always tell people is that PPE that was done to market the horse, that does not take the place of a new PPE. Like you still need to do a PPE. If we've got images that are recent, we may not need to repeat those, but you still need to do a PPE even if one was already done. But it's always great if you can do those pre-purchase examinations, because then there's no surprises. You hope to
As a
decrease the amount of
seller, you're
surprises.
not also learning all of
Right.
the surprises on the day. You can at least prepare. Also, it saves you time. It saves you a hassle, and it also saves you from awkward moments of
Yes.
finding out that your horse has a screw in its leg. But that's just one small example. But other things as well, like that your horse has a heart murmur potentially, or is half blind.
And and a lot of the horses I work on, they're almost getting a PPE done every 6 to 8 months, because these are high performance athletes. We're looking at them on a regular basis, so it's almost like they're getting a PPE done every 6 months, so we know where we're at.
Yeah.
But if you've had this horse for years, get that pre-purchase done before you sell. Know what's going to come up. And I think that's important. Plus, it allows you, it kind of opens up your buying network as well. Because if you've got something you can send people, it kind of like, all right, well, it looks good there. Maybe we'll fly in and take a look at this horse.
That's true. And buyers do love to see prepared sellers that already have like recent X-rays. It's just a good look. Yeah.
Well, and that's one of the things we'll get into is like everything's looked great on this PPE. We get into imaging. And I always say imaging is the best thing we have for a crystal ball. It's going to give us the best idea, and it serves multiple purposes. One, if we've had positive flexions, is there a reason for that positive flexion? Two, a big thing for me is looking at and everybody just looks at the joints, but there's also soft tissue attachments around those joints, and I want to look at where those insert. Do I have big enthesiophytes coming off a sesamoid bone? Do I have a lot of sclerosis at the insertion of the proximal suspensory? And seeing those things kind of gives me an idea, like, hey, we've got something underlying here. This could be an issue in the future, and we need to know that. So I always say, don't skip the imaging.
Yeah.
I think it's very, very important. The other great thing about imaging is when you've got those baseline images as a buyer, you buy the horse and you did a great PPE, you've got full set of images. Let's say 2 years from now, something comes up. Your vet comes out and takes an x-ray, like, oh, what's this? What was it there at the time of PPE? We can go back and pull that and be like, you know what, it was there. Or no, it was not there.
That's true.
Gives us an idea. It kind of not only gives us that crystal ball into what the future holds, but it's also there for future.
It gives you a baseline.
Yeah, for future issues. Having that baseline, knowing what you bought.
Knowing what is normal for your horse.
Mm-hmm.
Also, I will make the comment, I love imaging, and imaging is extremely important, but I have seen both ways. I have seen horses with clean sets of x-rays that are lame as a duck.
Mm-hmm.
And I have seen hideous x-rays, and those horses are out there rocking the Grand Prix.
Right.
So.
And I think that's where, one of my favorite sayings is images without examination are pretty pictures.
Yes.
You have to have the
Imaging
examination.
is very important with the examination.
Right. And then we get into some cases, like when I have people buying like long yearlings or 2-year-olds, the bulk of the pre-purchase is the imaging. We're on an OCD and assist hunt. We're looking for developmental orthopedic disease.
You're looking for, do I need to put this thing in surgery? Do I need
Right.
to, what do I need to do?
Like I got an OCD. All right, let's go get that cleaned up before we start training.
Absolutely.
So I think again, imaging, and people always ask, what images should we take? Definitely anything like kind of my thought is if I have something that flexes positive or I have a concern somewhere, I always start with that because let's say we got a fetlock that's a little larger than it should be. Let's say we flex pretty sore. I'm going to start with that because if there's something there that's a no deal, we can stop the exam then.
Yeah.
But then once we kind of look at our concern areas, our problem areas, then we get into what I call the survey films. We're just getting you all that information. We're looking at the joints. We're looking at these soft tissue insertions. We're determining kind of what that future is going to hold the best we can. So the other one that comes up a lot is, and used to we never shot these, but necks and backs. I get asked that question a lot about necks and backs.
I think necks especially are becoming increasingly way more important.
I agree. I like to get neck films.
Especially as our breeding programs are getting shottier. We need to be on the hunt for necks.
Necks, and the big thing comes up in backs with kissing spine. And if you were to ask me the toughest films I read, it's going to be back films because I have got some pretty high level horses that if you were to look at their back, you wouldn't think they could walk across the street. Clinically, it goes back to the exam. Clinically, they're absolutely fine.
That's
it goes
what I'm
back
saying.
to
They've got hideous x-rays, but they're out there just doing it.
Yep.
They don't always match up.
Yep.
And I've seen horses with clean back x-rays, and they are extremely painful in their back.
Yep.
That was what I was thinking of when I said that earlier. Backs in particular.
Yep.
Because I just did a set the other day where that horse, I barely touched him and he almost hit the floor. And I'm talking severe back pain, x-rayed his back, clean as a whistle.
Then you
I
get
was
into
like, of course.
Right. Because then that opens up. Are we dealing with like a neuromuscular issue? Are we dealing with pain from poor saddle fit?
No.
Are we dealing
not
with multifidus muscle soreness? And I think that's when it gets really complicated when we're trying to interpret. And at that point, it's okay. In that situation,
imaging has to be taken into consideration with everything else to create the full picture, but you can't have the full picture without imaging.
I agree. I agree. And I think it's, that PPE is one of the most important things that you're going to do because, again, it's not pass or fail. It's about uncovering as much as you can to lower your risk. Because I tell people all the time, the cheapest thing you're ever going to do is buy the horse.
Oh, yeah.
Because it costs the same to feed a lame one as it does to feed a sound one. It costs the same to shoe a lame one. Well, it probably can cost more to shoe a lame one than it does to shoe a sound one. Your cost, your month, boarding doesn't change. And so it's one of those things that those monthly costs don't change. So
I feel that way about horses with bad attitudes. I feel that way about horses with terrible personalities. I'm like, they cost the same to keep around the barn as the sweet ones.
I think one thing I was talking to another vet. Oh shoot, I cannot remember John's last name. It's not Steele, but John. He's down in South Florida, and I remember I had this horse that is probably the most perfect PPE I've ever done. And as far as I know, this horse is still yet to take a lame step. He went down to Wellington for the winter, and I called John. I was like, "Hey, I got this horse coming down. Just heads up, he's going to have to be sedated to get shot on the back end. There's a few things." And I said, I told him, I said, it's interesting because it was the most perfect PPE I've ever done. And John said, Dan, they all have a hole somewhere. They got a hole in their head, a hole in their heart, and they got a physical hole. We can fix one of those. And I've always thought about that. It's like, when you talk about the attitude, a lot of physical problems we can fix. But if they have no heart and they don't want to try, they have no talent, it makes doing the job very difficult. And if their attitude is really terrible, that's hard to fix as well. So you got to kind
Next
of
to impossible.
that's what we talk about. There's like so many pieces to this, and our job is to look purely at that medical.
The physical, medical
We're
aspect.
here to
Yeah.
look at physical, and we're here to look at medical. The rest of it, whether it has talent, whether it has a good attitude, a lot of these things, that's
Well, our job kind of overlaps with attitude a lot because we start talk about behavioral issues.
there are behavioral issues, but again, that's I may tell you that, but at the same time, that's kind of up to you. Like, are you willing to live with this behavior? Because I mean, some
Or what I
horses,
meant was like a lot of people call us out for behavioral issues.
Right.
Because, yeah.
so uncovering as much as we can from that medical side is critical. Before we end, craziest thing,
Last one was blood work.
blood work. Yes,
That's
yes.
kind of the last thing that I do is blood work. So really commonly, people will have a basic CBC chemistry pulled on a horse to also establish baseline.
Right.
Most of the time when we're doing a PPE, we're seeing a horse when they're healthy. So it's nice to have a baseline established for same reasons as you were talking about, having x-rays to just establish that baseline for further down the road if the horse was ever to become sick. We know like what's normal for that horse, and it's nice to just be able to compare that. Also to just check general things like kidney function. That's a sneaky one.
Kidney function. When you talk about sore backs,
Liver function, kidney
sore
function.
backs, clean back films, you run that blood work,
CK.
CK and ASTs up. All right, we got a primary neuromuscular issue going on here.
Yes,
So we need to know that.
we do.
One of my big ones that I'm a big proponent of is drug testing.
Yes.
Personally, I think we should drug test every horse we do a PPE.
And there are about 100 different things you can drug test for. So you got to kind of pick and choose what you want. There's pain medications, there's sedations, there's all kinds of stuff. But those are probably the big ones, the two biggest, most common.
Oh, and I can tell you in all the drug tests I've run, I've only had one ever come back positive. One in 15 years. But what I tell people, it also plays into when you get that drug test done. If I'm a seller, I'm going to encourage that drug test because I don't want something like, let's say this horse's behavior changes 30, 45 days in. If you got a negative drug test, the horse wasn't drugged with a long-acting tranquilizer. It kind of clears the air. It's a great way to say, hey, I did things right. And I think here we hold blood for 30 days for future testing. We spin it down, keep it frozen. We've got 30 days, and then it's so if something comes up in the first 30 days, we can always run it. But I really encourage people like run that drug test because then you'll never have that thought in the back of your mind. Like, let's say it goes lame. Well, did they have the horse buted when I did the PPE? Well, if you got a negative drug test, no, they didn't. Did they have some kind of a tranquilizer on board because now the horse isn't acting right? It gets rid of that. Did someone do me wrong? And that's why I say if I'm a seller, I'm going to encourage it because it's going to say, hey, you can look, I'm selling you a clean product. This horse hasn't, I didn't do anything. And I think it just clears the air and makes for a much smoother transition.
Yeah.
So I'm with you. I do like blood work.
Yeah.
All right. My favorite part, craziest thing you found on a PPE.
I got to go with the tetralogy of Fallot.
Yes.
I don't think that was like a mic drop.
I mean, that's pretty incredible.
Even the university was like, we have only ever had one of these come through. So that was my gift to the university.
Yep.
3-year-old gelding thoroughbred. He was literally the sweetest horse ever. He was so sweet. They never raced him because they said that they would put him out there and he was just such like a gentle soul that he didn't want to run. And I was like, yeah, I probably also couldn't, but
Circulate blood to function.
they said that he just didn't have the heart to run. Literally. But yeah, so tetralogy of Fallot, he had a really enlarged heart. His heart was like tilted forward, and yeah, he is no longer with us. But that was the coolest PPE finding that I think I have had.
That's cool.
Yeah. And that was first thing I did. Walked up, put my stethoscope on the horse, and found that. So, what about you?
Well, I think it was probably the horse that was blind in the left eye.
Because it was at the end.
Because it was at the
He
end.
fooled you the whole time.
Well, I mean, that's the thing. I mean, you've been around horses that are
He
lacking
tricked you.
vision. They're either
Usually
jumpy.
you can kind of tell.
Right. They're kind of jumpy, or they're kind of always turning their head trying to find you.
Or they do this where they look at you kind of like this.
Yeah.
When you're standing over here, they kind of look at you a little
And
sideways.
I'll never forget it. We got through the whole exam, and then it comes down. It's like, all right, because I was waiting. We didn't have to sedate him for radiographs. And I get ready to do the ophthalmic evaluation, and I go over and check a menace, and go up to the left eye, wave my hand in front of him, no blink. Go to the right, I have a blink. Left, no blink. Like nothing. Nothing. Could see absolutely nothing.
So he was just he was cortically blind.
Yeah, he was cortically blind.
Yeah.
In that left eye,
Wow.
nothing. And it just kind of amazed me because, like I said, there was no indication throughout this exam, because most horses will give you an idea like, hey, I can't see, especially the left side.
Yeah.
You think about how much stuff we do on the left side of a horse.
Yeah.
And this horse was clinically blind.
He's like learned to live his life.
Interesting fact of the day, do you know why we mount and dismount and do so much stuff on the left side of the horse?
It's because of your sword, wasn't it?
Yeah.
Yeah.
Sword was on the
Sword
left.
was on your left, so you had to swing your leg over with the non-sword side.
Yeah. It was interesting when I found that out. Learned that years ago. So, fun fact of the day. So, all right. Well, that kind of sums up the PPE. I imagine we're going to have another episode on this and take an even deeper dive, because, looking at it, we just kind of barely scratched the surface on thinking through a PPE. I mean, this is a huge topic. And like I said, we didn't even get into like breed, discipline, common things we look for. So I think we're going to probably have another episode on PPEs, because like I said,
It's a lot to think about.
we just scratched the surface. We just scratched the surface on
I
that.
think this was just the broad overview.
The broad overview. So we're going to do a
I know
deeper
it was
dive.
like 55 minutes long, but it was still only just the broad overview.
Yes, I
'Cause
mean,
there's a lot going through our mind when we come to a PPE.
Right.
That y'all probably don't even know that's going through our
Yes.
mind, but don't worry, we got you.
Yeah, we got you. We'll get another episode in there. So, Dr. Zoe, thanks for being here today. Hey, everybody, thanks for listening in. We really
Thank y'all for
appreciate it.
listening, and
Like I said, don't forget to let us know what country you're listening in.
or city or state or
that'd
wherever
be
you're
really
listening
cool.
from.
So, if there's anything that you want answered and you want us to do an episode on, please reach out to us. You can text us, call us, email us, DM us. We're still waiting on a letter to come in. Dr. Caitlin the other day said she'd never had a letter. She'd never received a letter. So, again, if someone mails a letter, then we're going to get you some swag. I want to see a letter come in. So
Cool.
And for those of you under the age of 25, a letter involves a stamp. You can get those at the post office. But yeah, reach out to us somehow. And
Probably watch a TikTok on how to mail a letter.
yes, I don't even know if TikTokers know how to mail a letter.
Somebody's made a TikTok about it. Trust me.
Surely, if not, somebody should. So, all right, thanks for listening in, folks. We really, really appreciate it, and look forward to seeing y'all next time.
Thanks for being here.